Hello, everyone. This is Dr. Dilip, and here with us, Dr. Keerthana, who scored an astonishing score of 303 in the NEET SS exam, and her dream branch is nephrology. And here with me, Dr. Keerthana, and hello, Dr. Keerthana.
Hello, sir.
And how does it feel to finally own your dream after so many years of hard work?
I'm so happy. I'm going to next stage of life. Let's see, sir.
Okay. In the sense, like when you got the rank first, I mean, what does it feel? So you are expecting this rank, or you're not really expecting this rank?
No, actually, I didn't expect this much score, sir. But since the exam was very tough, in medicine part, they asked a lot of neurology questions. Out of 40 questions, there was more than 25 questions in like core neurology, sir. Those after those attending those questions, there was I doubted myself. But after the result, I'm so happy. But nephrology part was considerably easy compared to the medicine part. Medicine was the deciding factor, I think, sir.
Okay. Nephrology, you felt it's a little easier.
Yeah, compared to medicine part.
Okay, medicine part was a little tough.
Yes,
Okay,
sir.
that is what many students also have commented on. So that the medicine part was a little tough, but the specialty part was okay. I mean,
Yes.
again, it depends on the specialty that they prefer.
Yes,
And
sir.
nephrology actually was supposed to be a little easy, but the cardio
Yes, sir.
part was a little tough, I guess. So, anyways, nothing to worry
Yes,
about
sir.
that. So, anyway, so when did you start your NEET SS preparation, and how much time, in your opinion, does one require for the preparation?
I started my preparation in final year only, sir. Since I am the COVID batch, I didn't get much of time to prepare, give hardcore preparation. I had time only 4 to 5 months before the university exams to completely give my full attention to academics. By side, for preparing for university exams, I started preparing for nephrology. Mostly, I concentrated on Harrison and Figali book only, sir, and Dilip sir videos in nephrology part.
Okay, so which study resources did you rely upon as far as your preparation is concerned?
Study resources, books. You have to get a good grasp on Harrison. It's very important for clearing NEET SS. Next, Fihali book. I made notes of difficult topics, and then I referred for Dilip sir videos on tough topics like electrolytes, acid-base balance. Uh, that gave a clear understanding of the subject, sir. Because this time NEET was not just one-liners, mostly it was conceptual questions also were there. And if I had a thorough understanding only, I can clear the MCQ within 1 minute of time. So your videos helped me, and I also gave 2020 exams on NEET SS. That time, NEET was little bit easier, sir, compared to this year. Mostly the questions were one-liners, and only just with the basic medicine knowledge and Harrison knowledge, we can clear that exam easily. But this year, the exam was really tough. It was on par with the Central Institute exams. So we should be more trained up in understanding the concepts, not just mugging up from the book. So your videos on electrolytes was all very nice, sir. Potassium, sodium, because sodium, understanding the concept of hyponatremia and all from the studying from the book is not enough. You have to understand the concepts, keep studying and keep revising again and again to have a gain of knowledge, sir.
Okay. Anyway, so even if the exam was tough, if your core concepts are clear, you will be able to easily crack the
Yes, sir.
exam, and that's what you exactly
Yes, sir.
did. So you, I
Yes, sir.
think, struggled a lot to strengthen your core concepts rather than like just learning the facts from the textbooks, and that's
Yes,
what
sir.
I feel like it helped you in your exams. And anyway,
Yes,
so
sir.
which factors did you consider while selecting the specialty branch? Because girls, I would say, like they generally tend to prefer a less interventional field. I mean, it again with no offense to any gender, but I would like to say, like, generally, like they tend to prefer less interventional fields because they feel like cardio, neuro, nephro, especially cardio and nephro, the hardcore fields, so which needs a lot of like effort, and it needs a lot of duty. You have a lot of stacking up of duties in your post graduation, another 3 years of hardship. So what factors did you consider before choosing DM nephrology?
No, I got an interest in nephrology while doing peripheral postings in super specialty like nephro, sir, in second year only. Um, uh, the thing was, nephro was more closely allied to medicine. I really like medicine so much. So the only branch which is close aligned with medicine was nephrology, because cardio goes in some other direction, neurology also goes in some other direction. There was no touch with medicine. Since nephrology is morely basically it's medicine, and Professor Edwin Fernando sir, HOD of nephrology, also inspired me to become a nephrologist. Nephrology, it is a tough subject to study, but only no pain without gain, no sir. Sorry, no gain without.
It's good actually. You
Mm,
mentioned Dr. Edwin
mm,
Fernando's name.
mm.
Actually, I mean,
Yes,
he's there with me in Dr. Mehta's only. And
yes, sir.
to be honest, he's such an inspiration to many people to take up nephrology. And even throughout the nephrology, if you're doing a DM nephrology in Stanley Medical College, he's one of the kind of persons who tends to help at any time, any point of time, and
Yes,
who tends to what to say, like you inspire you a lot, and he gives you a lot of chances in different areas to explore yourself.
yes,
So
sir.
like it's a very kind and a gentle and a very honest soul. Anyways, which part of the PrepLadder app, so you are a student of PrepLadder NEET SS, and which part of the PrepLadder app did you consider the most beneficial? Like, for example, is it the MCQs or the videos, or probably the mock tests? So, I mean, whatever. So, which part did you consider the most beneficial?
According to me, when I subscribed for PrepLadder, I initially, when there was much gap before exam, 6 months before the exam, I used the videos only, sir. I didn't start preparing the MCQ by at that time. I used the videos. I got a grip over the concepts. Then, just 2 to 3 months before the exam, I started using MCQs. Then that quiz of the day, daily 5 MCQ per day, was quiz of the day in a PrepLadder. That was also useful, and mock exams also very useful, sir. I tell all everything was essential for me. Everything was very useful for me.
Okay, so you
All
don't
the three
consider any
videos, MCQ,
thing, so you feel like everything is very
eh,
beneficial in the PrepLadder NEET test.
everything. I just can't tell just videos are enough or MCQ is enough. All the three was very useful for me.
Okay. Okay. So, what challenges did you face during this journey? In the sense, you told you are from a COVID batch,
Yes, sir.
and that makes the preparation as well as the examination even more challenging and tough. So,
Yes,
what are
sir.
the challenges you really faced, and how did you tackle upon?
Yes, we were the batch. We handled two waves in 2020, 20. Then again last year 2021 when the COVID was peak and my exams, university exams were postponed for 3 months up to August. Everything was unexpected. Even the university exam was postponed. Even NEET was postponed, and in between there were confusion for uh, they there was they put a new pattern, no sir, for 100% full MC medicine questions, and I started preparing for that pattern for 1 month. Then again they changed it. So there was a lot of confusion. Just the passion to be a nephrologist only kept me going, and I wanted to finish it soon because in between I had my marriage also. So I had little bit of distractions also, but just just the passion when kept me going, sir.
Really,
And during last year, it was really tough in 2020, 2021. They in Stanley they used to keep COVID duty 1 week, then quarantine 1 week, and again COVID duty 1 week. That was all really tough, very tough, sir. I couldn't concentrate on uh, my subjects. It was tough. Then afterwards we got used to it and studied, sir.
no, it's really difficult to prepare in such a situation. Like when you wanted to
Yes,
do
sir.
COVID duties and you don't get exposed to anything else apart from COVID. So in those
Yes,
tough
sir.
times, and many MD students also have texted me personally saying that, sir, we couldn't study anything else. All what we are doing right now in the last 1.5 years is just treating COVID patients and not able to take care of anything else. The general routine OPDs are closed and nobody is coming to the OPDs also. Only emergencies are running and it's full of COVID patients everywhere. And we're not getting exposed to different kind of cases also like what we are supposed to. And in that situation, like getting into this sort of rank with all the difficulties and challenges that you have faced, that too in the, like maybe I can say the first attempt to some extent. So it's really phenomenal. And first of all, I need to really congratulate you for that.
Thank you.
And one last and final question, Keerthana. So what is your message to the SS aspirants who's watching this video right now?
You start preparing early so that because sometimes I didn't start preparing from second year. I regret that now because in my third year COVID happened and it was very difficult for me. Just get a grip over Arison. Arison is the Bible of medicine. Then for nephrology, additional you read Fihali, make notes because keep reading again and again from book is not going to take you anywhere. Make notes and practice as many MCQs as possible.
Yeah, and MCQs are really important. I used to say this in every single video. So most of the students, they like to concentrate only on the video part or the notes part, but they forget that MCQs are also equally important. And if you don't solve the MCQs as much as possible, it's very difficult to crack the exam also. So you have to give as many MCQs as possible, and you need to give as many mock tests as possible as well. And that's rightly said, Dr. Keerthana. And I think it's a pleasure talking to you. And first of all, and congrats to what you have achieved. And I mean,
and thank you to you also, sir.
Yeah, thank you so much. And a real salute to all
your... Sir. Santosh sir. Santosh sir also.
Yes, Dr. Santosh sir is also there. Yeah, so I will definitely convey your regards to him as well. And thank you very much. And congratulations once again. And salute to your hard work. And take care and all the very best.
Thank you, sir.